Hello and welcome. This is Hands on Health, the podcast all about living your healthiest life on the coast. I'm Austin Miller.
And I'm Alyssa Evans. Today we're joined by Allison Whisenhunt, CMH's Director of Behavioral Health and Care Management. Allison, thanks for joining us today.
Thanks for having me.
To get us started, would you mind by telling us what is care management?
That's a great question. Care management is really kind of an overarching umbrella term. People use the term care management interchangeably often with the term case management. Here at CMH, what care management looks like is a team of nurse care managers and licensed clinical social workers that are focused on helping folks live their best life, be as well as they can be, get home from the hospital with the right resources so they can hopefully stay out of the hospital, so on and so forth. Care management also includes looking at insurances and determining what resources are available depending on the payer. Healthcare itself is a very complex system and very difficult to navigate in a lot of circumstances. So my team really works with folks to learn how to manage their health within some of the challenges that we have with our healthcare system.
That's neat. Would you mind telling us what inspired you to work in this field?
Yeah, I am a licensed clinical social worker by trade. And when I was getting my master's in social work, I did an internship in a healthcare setting, and I absolutely fell in love with the interdisciplinary team, the different perspectives that everyone had, and really partnering with folks to help them figure out what's best for them and how they want to manage their health. I love helping people, and I love leading this team of fabulous clinicians who are helping people every day in all kinds of ways.
Would you mind explaining what behavioral health is too, since that's another part of your role in your department?
That's a great question too. I love talking about behavioral health. So behavioral health, again, another kind of umbrella term that covers mental health diagnoses as well as what we call substance use disorders. And we have social workers embedded across the whole continuum of care at CMH so that we're able to serve folks in every point of care and help them figure out their goals of care and how we can best support them meeting those goals at CMH. So for primary care, our social workers are focused a lot around mental health and substance use disorder diagnoses and treatment through psychotherapy services. In some of our other settings, our social workers are helping folks coordinate their care, get resources such as transportation to get to appointments, and sometimes acting as almost a translator for our patients, because in the medical field, we have our own language and lingo and acronyms. And we try really hard to make sure the patients are understanding what's being offered to them and that they are empowered to speak up for what's going to work and what's not going to work for them. Sometimes the best medical advice isn't something that will work for someone's life, or they're not willing to make those kinds of sacrifices even for their own health. And so a large part of what we do is really support folks in identifying what's important to them and helping them communicate that and getting resources in place or doing what we call harm reduction. So for example, if someone is encouraged to quit smoking and they're not interested in doing that, a social worker may come in and talk with them about harm reduction. So what would it look like if you cut back just one cigarette a day? And continuing on with motivational interviewing and helping folks celebrate successes when they do make some changes and encouraging them to continue on that path while still supporting them if they're not quite ready for that yet.
Wow, that's a lot. It always amazes me as we've been interviewing different people, how many behind the scenes different jobs that people just wouldn't think of as far as people who work at the hospital and some of the things that they do. I think we all think of doctors or nurses kind of as the poster child of medical care, but there's I'm just amazed at how much goes on behind the scenes. Allison, how long have you worked here at CMH, and what brought you to the coast?
Yeah, so I have been at CMH, it will be 4 years this June. And what brought me to the coast, I grew up in Ohio and moved out to Oregon and just really fell in love with the scenery and the pace of life, the culture, the people. It's just really, this is home for me. And being next to the ocean with mountains and forests around me is really the ideal setting. So I just absolutely love the North Coast area.
Would you mind explaining what a day might look like for you? I know there's probably not a typical day because a lot of different issues come up and you work with a variety of different caregivers, but also different patients. But what does a week look like for you generally?
Yeah, I appreciate you saying that there's probably not a typical day. There's also probably not a typical week. But to give you just kind of a general sense, I start my day by rounding with my team, and that's the acute care or the inpatient team. So those are our nurse care managers who are helping folks try to, again, get out of the hospital to whatever level of care they may need with good resources in place so that they can again, hopefully avoid being readmitted to the hospital. I also work very closely with our social workers in the morning that are helping cover the emergency department because their main focus is helping support patients that come to the emergency department in a behavioral health crisis. So think someone who is suicidal, someone who has a severe mental illness that's not being well managed, those types of situations. And their job is to do really in-depth assessments and care planning for those folks in the emergency department to try to de-escalate the emergency. And if we aren't able to do that, help them get to a hospital that can provide psychiatric care. So our huddle reviews all of our patients and any challenges we may be facing systematically that are impacting their ability to achieve their goals. We're also looking at, unfortunately, insurance and payers because we want to make sure our patients are fully aware of any expense they may incur. And insurance companies often will tell us that they don't think the patient needs to be in the hospital anymore, which is a very challenging situation to navigate. After that, we have a organization-wide safety huddle where every department has a leader discuss different issues that may be a safety concern. So we talk about things like patient falls, inclement weather that may be coming, security issues, those types of things. And then after that, it really depends. So I could have a day full of meetings where we're looking at continuing to improve our processes, looking at ways to grow some of our services, planning for outside entities that do licensure and accreditation with us. There's a lot of oversight in healthcare, which is a really good thing, I think. We're always looking at quality improvement and just really focusing on the patient's experience. There may be days where I'm in my office working with data to look at how we're doing in some quality metrics. When I'm sitting in my office, if you were watching, you would see people coming in and out all day long. So that can be my own team coming in to either problem solve an issue, ask a question that they're not sure of what to do, or maybe even vent a little bit about some frustrations they're having. I think it's really important to support those folks who are doing the frontline work. And I always tell my team, my number one job here is to support them so that they can be the best caregivers they can for our patients. There are days where we may be short-staffed and I roll up my sleeves and I run over to the emergency department and start conducting those behavioral health crisis assessments. Or I go with one of my team members when we've got a family very upset and we try and problem solve and help them find a resolution to whatever their concern is. So it really It's very varied. And because I have social workers embedded across the continuum of the organization, I'm often going to spend time with them in some of the outlying locations. So I'm not even always at my office when I'm working.
Wow, it sounds like they keep you very busy.
The other thing I do is participate in a variety of different community collaborations. So different kinds of committees that maybe focus on a specific population of patients, looking at how our agencies can work together better, how we can streamline workflows, and how we can break down barriers for patients to be able to access the services they need at any of our agencies.
Could you, you've touched on this a little bit, but could you go a little more in depth on the different ways that you and your team interact with patients?
Absolutely. So on the inpatient side, our nurses are focused heavily on our medical and surgical and critical care units. Their job is to interview patients within 24 hours of being admitted to the hospital to start planning for what they might need when they go home, wherever home may be. Social work really varies on the location. So we have social workers, like I said, in primary care who are providing therapy, and then also oftentimes are having what we call warm handoffs, where the primary care provider goes and grabs the social worker and brings them into the clinic visit with the patient so they can meet and discuss whatever the topic may be. Again, that can range from they don't have transportation to get places, they don't have enough coverage or money for medications, all the way to they have a dying loved one and they're trying to figure out how to best take care of them. In our cancer center, our social worker is working with those patients very closely around new diagnosing, adjustment to diagnosis and illness, planning for treatment, and unfortunately at times planning for stopping treatment. We also have a social worker in our hospice program who interacts with patients in their homes mostly, goes to the homes of these patients and supports the patients and the families through the dying and the grieving process. So it really depends on which social worker we're talking about. I will make a plug for our Women's Center social worker. She does a lot of work with pregnant patients prenatally, and then once they've delivered the baby, she may also see them in our family birthing unit, and then again follow them postpartum so that she's able to continue to monitor for postpartum depression and resource needs and just overall anxiety around being a parent and how things are going.
I think that's really amazing. That's a lot of different work and different tasks. And I think it's really neat to hear all the different things that your team does. And especially, I'm glad that you pointed out too that they work throughout everywhere in the hospital too. I don't think people always realize that. And it's a really incremental part of the hospital. So
I agree, and I get so excited to kind of brag about these clinicians. They're just phenomenal, and I'm really, really grateful that CMH has recognized the value of the services that they offer. When I started here, we were a very small team, and we have grown quite a bit to expand these services, knowing that our community is struggling with behavioral health challenges and that we're in an area where we are short on enough behavioral health providers for the need that we have in the community. And sometimes there are services that you wouldn't even think are needed, but last year, we added a social worker to our medical and surgical specialty clinics, and they're working with patients who are about to have a significant surgery to improve their quality of life. So, for example, a total knee replacement or a total hip replacement. and really looking at not just the resources they're going to need after the surgery, but also what is their relationship with pain? What has their experience with pain been like? Because it's a painful procedure and there's no way around that. So how do we plan to really support folks? Because we don't want to just take pain medication all the time. That's really a dangerous kind of slippery slope for folks. And we're looking at anxiety around surgery and a lot of the different feelings that come up with that. So there's just a wide range of ways that CMH is able to support patients that we weren't able to do quite as well a handful of years ago.
If someone hasn't already gotten a referral to work with your team, how can they go about getting connected with your team if they do need help?
Yeah, we get referrals from all over. So sometimes it comes from a medical provider that patient is working with. Sometimes it comes from a community member who is recognizing that we may be able to serve this person in some way. There are times people just walk in and ask to speak with a social worker or a care manager. There's also information on our website about our behavioral health services and how you can reach us in that respect. But when in doubt, people can call the main hospital line and ask to speak with care management or ask to speak with a social worker. And then we'll talk with them and kind of triage and figure out which point of care social worker would be the best person for them.
Do you have any suggestions maybe on ways that patients can take care of their mental health?
This would be a whole nother podcast. I think every single person needs to pay attention to their mental health just as much, if not more so in certain circumstances, as they do to their physical health. What we know is that everyone has challenges in life and everyone has had some level of difficulty and challenging experiences. And that's on a continuum. There are some folks who have experienced a vast amount of trauma in their life and others who may say, I haven't experienced that much of that. It's not really about the quantity. It's really about the reaction and the impact it had on someone's life. So I think we all need to recognize that in the last few years, I know I'm tired of hearing people say, during the pandemic, but the reality is that this has created a lot of isolation, a lot of anxiety, and a fair amount of depression and increased numbers of folks who are struggling with addiction or substance use disorders. What that tells me is that everyone has a level of struggle on some plane. What's important is that we do what we can to be preventative. So that includes all the healthy things you do for your body, like exercise, getting good sleep, drinking water. But I think for mental health, we really need to focus on our connection with others. There's been a ton of research out there about the value and importance of people feeling connected to other people so that they're not feeling isolated, so that there are other people around to recognize if they're starting to struggle. Relationship is so important, and we have so many different relationships that are possible in our life. And what we know is to counter trauma and to counter challenging situations, we have to continually exercise our resilience muscle. And that is best done in relationship with others. So I think if nothing else, I would like people to recognize how important it is that they have connection in their life in whatever capacity that may be. I think my other message I'd really like to impart is that there's a lot of potential for negative health outcomes and mental health outcomes when we experience trauma early in our life. There's been a lot of research around what they call ACEs, adverse childhood events. And what we have found is that the antidote, if you will, to those traumatic events is for these kids to have some positive, stable adult relationships in their life. And while most of those positive childhood experiences, they call, are related to their immediate nuclear family or whoever they live with and who takes care of them, one of those measures that they've studied is whether or not that person has at least one or two adults outside of the family unit that they believe has an interest in them or that they feel is a safe person. And I think all of us can do this, whether or not we have kids in our home or kids in our life on a regular basis because we work with them. It can be as simple as a child that's in your neighborhood that you take an interest in. And it doesn't mean you have to be a big brother or big sister and take them to lunch and all the things. It's really just whatever you can do to let that kid know that you see them and that you think something's great about them. So I think my message recently, when I've been doing some different presentations in the community, has really highlighted this and really been focused on, if nothing else, make sure you're connected to others. And if you're around children at all in your life, try and show up for them in some capacity. Then if all of that fails and you are struggling, please, please, please reach out for help. What we know is that our suicide rates have been increasing nationwide. And when we look at the demographics, people of color, people with gender issues, different sexual orientation, kind of all the marginalized, potentially marginalized populations, suicide rates are exponentially higher for those folks. And what we want to do is catch depression or catch anxiety before it has progressed into a crisis situation. Reaching out for help may mean that you are reaching out to someone who's in your life and saying, I need a little extra support. I need somebody to give me a reason to get out of bed today. And it could mean reaching out to your primary care provider. There sometimes are medical conditions that are impacting our mental health. And again, if people are struggling, the evidence shows that the best course of treatment for diagnoses of mental health illness are medication and therapy combined. It doesn't mean it's right for everyone and everyone needs to do it. But what I would love to have happen is when we have a cold, we think we probably should get that checked out. We have something happen weird in our body physically, we ask for help about that. I want that same thing for our mental health. I want to normalize mental health challenges and encourage folks to not be ashamed and to support others in taking care of their own mental health as well.
Have there been any standout experiences that you've had while working here that you would like to share?
Again, that would be another series of podcasts. I am just so proud of the work that my team has done. I'm proud of the work that all of CMH has done, but I will focus on my care management and social work group. One thing I'm very proud of is when I first started here, we didn't have a very strong social work presence in our emergency department. And that is where people come when they're really not having a good day. And there's a lot of resource needs, and there's a lot of de-escalation and crisis intervention that social work can offer that really complements what the medical team is doing. So I'm very proud that we now have social workers in our emergency department 7 days a week, 12 hours a day, to really try to impact those folks who are in crisis. And a little bit like the nurses on the inpatient side, where they're trying to help folks stay out of the hospital, we want to help folks stay out of the emergency department as well. It can be a traumatic and scary place, and if that's what people need, absolutely that's where they should be. And we want to do our best to have them have the support that they need on an ongoing basis, not just an emergency basis. The other thing I'm very proud of is our nurse care management team and the expertise that they have developed over the past few years. Watching them grow as professionals has been so fun and so rewarding. And during the pandemic, though I'm tired of saying that, during the pandemic, we have experienced more challenges in the hospital than we've ever, I think, in healthcare history. And that's largely around not having enough staff for the amount of sick patients that are here. And that's not unique to our community or to our state, but there have been times where we have very sick folks who we can't get transferred to a higher level of care because those hospitals are full. And we've had lots of times where patients really needed to go to a facility for some additional care before they go home. And those facilities just haven't had the staff and the bed availability to help us get folks out of the hospital in the timely fashion we've been used to. So they have just been amazing at problem solving, thinking outside the box, coming up with ideas and potential solutions. It's just been really remarkable to watch how they have persevered through all of the adversity. We're not out of the woods. A lot of this stuff is still happening, but they do it with such grace and such compassion. I just can't say enough about how proud I am of them.
Well, Allison, is there anything else that you'd like to share or let people know?
I would like people to know that whether it's social work or care management, there's nothing to be worried about with that referral. I think a lot of times people have a very negative connotation to the word social work. I will tell you, when I tell people I'm a social worker, I usually get questions about taking away people's children and things like that. We don't take away anybody's children. And our goal is really, if someone is in a situation where they're struggling with parenting, to walk alongside them and help them build those skills and the resources they need to be successful at that. Social work does not mean people think you're crazy. Social work does not mean people think you're poor. When a provider or anyone suggests you speak with one of our social workers, it's truly because they believe that there is something they can offer that's going to make your life a little easier. Same thing with the care manager and the discharge planner. Sometimes they get a bad rep because they have to have hard conversations about what insurance will pay for and what it won't. So they're kind of the messenger that gets shot sometimes. But just know their main focus is to help each individual person and their family achieve the goals that they strive for. It's very challenging in this time in healthcare, as well as in a rural setting. But just know that if someone suggests care management or social work get involved, it's almost always for a very positive reason and just to be helpful.
Well, thank you for joining us today, Allison. It's been really great talking to you and getting to hear more about your job and all the other teammates that you have in your department.
Thank you so much for having me. I would have loved to have had some of my team here, but they're all so busy.
Well, thank you too for joining us today. This has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.
Find us wherever you listen to podcasts, online at columbiamemorial.org, and on Facebook, Instagram, Twitter, and LinkedIn. Thanks again for listening. We hope you'll join us next time for another episode of Hands on Health.